How does cryosurgery treat skin conditions by freezing? Imagine using extreme cold to gently remove unwanted skin growths or treat precancerous spots. That's essentially what cryosurgery does. It's a minimally invasive technique that has been used in dermatology since the 1800s to target various skin issues. The process involves applying very cold substances, usually liquid nitrogen, to destroy abnormal or diseased skin tissue. It's often chosen because it's quick, effective, and leaves minimal scarring when done properly. The way cryosurgery works is fascinating. When the cold substance is applied, it causes the targeted tissue to freeze rapidly. Ice crystals from both outside and inside the cells. Outside the cells, these ice crystals draw water out, creating a gradient that causes water to rush out of the cells, leading to cell dehydration and death. Inside the cells, the ice crystals can physically rupture the cell membranes, causing the cells to die. This cellular damage is the main goal when treating benign growths or precancerous lesions. Another important part of the process involves blood vessels. The extreme cold damages small blood vessels in the area, leading to blood clots and stopping blood flow. Without blood supply, the tissue cannot survive and eventually dies. This process is called ischemic necrosis. When the tissue is frozen and then allowed to thaw, the thawing phase also contributes to tissue destruction. As the ice melts, water rushes back into the cells, causing them to swell and burst, which further helps eliminate abnormal tissue. The technique used to apply cryosurgery depends on the size, location, and type of skin condition. For example, a spray method uses a device called a cryogun to deliver liquid nitrogen directly onto the skin. This creates an ice ball that covers the lesion and a small margin around it. The treatment usually involves freezing for a few seconds to a minute, then allowing the tissue to thaw. Sometimes, the process is repeated in a double freeze-thaw cycle to ensure complete destruction of the abnormal tissue. Liquid nitrogen is extremely cold, reaching temperatures of -195.6 degrees Celsius. To effectively destroy abnormal tissue, the target area needs to reach at least -60 degrees Celsius. The depth of tissue destruction depends on how long and how often the tissue is frozen. Typically, the maximum depth of freezing is about 10 millimeters, which is enough to treat superficial skin lesions without affecting deeper tissues. Cryosurgery is especially useful for benign skin conditions like actinic keratoses, which are sun-damaged precancerous spots. Studies show that longer freeze times improve the chances of complete removal. For actinic keratoses, freeze times over 20 seconds can lead to cure rates of over 80%. It's also effective for seborrheic keratoses, which are common benign growths. Sometimes multiple treatments are needed, especially for larger or stubborn lesions. Healing after cryosurgery usually involves the treated skin blistering and forming a scab. This scab falls off within about a week, revealing new, healthy skin underneath. Complete healing can take a few weeks, depending on the size of the treated area and individual healing ability. During the procedure, patients often feel a cold sensation, followed by a stinging or burning feeling, but discomfort is generally temporary. One of the main benefits of cryosurgery is that it is non-invasive and offers excellent cosmetic results. It can be performed quickly in an outpatient setting, often taking less than half an hour. While side effects like redness, swelling, or temporary pigment changes can occur, serious complications are rare. It's important to remember that cryosurgery is part of a comprehensive skin health approach. Regular skin checks, sun protection, and prompt treatment of suspicious lesions are key to maintaining healthy skin and preventing more serious conditions. In summary, cryosurgery treats skin conditions by freezing targeted tissue with extreme cold, causing cellular damage and blood vessel injury that lead to tissue death. It's a safe, effective option for many benign and precancerous skin issues, helping to keep skin healthy and prevent progression to more serious problems. Always consult a qualified healthcare professional to determine if cryosurgery is right for your skin concerns and to ensure proper treatment and follow-up.